I'm going to be explaining how the Graphnet's CareCentric shared care record solution is being used to support care teams delivering the Oximetry at Home programme. So in areas like Frimley, Berkshire and Greater Manchester, CareCentric is being used to manage patients with COVID-19. And at the very start, there are typically two routes into that programme. Individuals presenting with symptoms directly, or a proactive case finding route. And the latter uses a new candidate discovery report, which we have developed, which flags up recently tested COVID positive patients and combines this with other risk factors and indicators from the shared record. For example, we can identify patients with underlying conditions such as COPD or risk factors like high BMIs, factors that can affect outcomes, enabling the targeting of care more efficiently. And those individuals can then be proactively contacted and assessed in addition to those being referred in. And once a patient is enrolled, the care teams can then triage, assess and advise using the clinical portal and embedded dashboard views. So looking at from the individual patient perspective, they use the secure iOS or Android My CareCentric app using their NHS login or preferred media accounts such as Apple ID or Google or Microsoft Live. And then from within the app, they can quickly enter new observations, refer back to their previous entries and view information and advice that's been shared with them. And supporting that are complex clinical business rules built into the solution so that to prompt the individual to retake the measurements if required, or if they're still out of the normal range, then prompted to take the appropriate action as defined by the local area. And this local tailoring is extremely important so that the person receives clear and accurate instruction. And finally, any ad hoc advice and perhaps encouragement added by the care team can also be seen by the individual within the app's journal view. So then looking at the care team's perspective, they would then use the caseload team report to manage the patients under their care. The view would show up-to-date observation entries and professional assessments that have been made. And hovering over each entry, each patient row would show a brief history of the latest entries. And they can then, at that point, decide if they need to drill down and access the full record. So they'd launch the shared record view directly from that dashboard. And from there, they would see the alerts, the rest of the shared record as normal. But then in this case, in this area, they've labeled the care at home module. They can then go in and see that additional detail that's been entered by both the patient and their colleagues in the care team. And then they would then have the options to perform a number of different actions depending upon the particular situation. So they might be adding some additional recordings over the phone. They might be asking the person to do an exertion test whilst on the phone. They might add some advice, as we talked about, advice that would flow back into the patient app, and perhaps change the frequency. They might even want to do a more detailed assessment at that point, which they can do in the clinical portal, and that's then immediately shared with all the other care professionals who might be accessing that record. And the idea is that they can, one tap, access the history of information and keep using that throughout that home monitoring period. And then hopefully at that point, at the end of that period, the person will scale back from their high frequency monitoring. However, if the person their situation does deteriorate and they are admitted to hospital, then the acute care teams can access that wealth of information from that period of home monitoring that they wouldn't have otherwise had access to. So that was a very quick tour. In summary, the Graphnet module enables the Oximetry at Home care teams to proactively identify individuals who would benefit from home monitoring before they present with symptoms potentially, using the candidate discovery report. The patient would use the My CareCentric app to collect their observations, refer to information and receive timely advice and guidance. And all patients, whether they're using the app or not, will automatically appear on the team's caseload view, where they can see the most recent activity and access the record directly from their to contribute to it and add that additional information as required. So as the NHS and care organisations continue to manage COVID patients, the ability to keep patients at home and monitor them safely is essential, and we are extremely proud to be able to help our customer partners achieve this. Thank you.